Hello everyone. Today we will discuss about loop diuretics. One drug which can treat pulmonary edema, causes hypokalemia, worsens gout, and can damage hearing, and it is asked in every exam, that is loop diuretic. Today in next 5 minutes you will master loop diuretic. So I'm going to tell you the important clinical roles which are associated with loop diuretic. First, the important drug which are included in loop diuretic class are furosemide, bumex, bumetanide, torsemide, and ethacranic acid. The mechanism of action we all know, they act on thick ascending limb of loop of Henle and block sodium potassium 2 chloride co-transporter, which results in increased urinary output. If we look at the dosing, 40 of furosemide is equal to 20 of torsemide, which is equal to 1 milligram of bumex, which is called bumetanide. So we can also say that 1 bumex is equal to 40 of furosemide. The most common drug which we use in loop diuretic is furosemide. If someone has diuretic resistance, then we should always use bumex because bumex has high potency. It is very potent and it is used in diuretic resistance. In terms of duration, torsemide has the longest half-life, which is 12 to 16 hours. So it is commonly used in patient with chronic CHF and the patient who has CKD also, because this drug is metabolized mostly by the liver. Diuretic resistance can happen, and we all know that loop diuretic act on loop of Henle, and when we block sodium potassium 2 chloride co-transporter, and when we use this drug long term, the distal convoluted tubule can get hypertrophy, which results in increased sodium reabsorption through the distal convoluted tubule. In those cases, we can add thiazide diuretic to increase the urinary output. One example of thiazide diuretic we use is metolazone. It is used in diuretic resistance. What are the clinical pearls associated with loop diuretic? Loop diuretic, they are amazing class of medication. They even work if patient has chronic renal failure and the GFR is less than 30. We all know that if GFR is less than 30, thiazide diuretic does not work very well. In those cases, we can use loop diuretic and they still work. Now, if the patient has gut edema, furosemide will not work properly, and in those cases we can switch furosemide to torsemide or bumex. Torsemide has the longest half-life, 12 to 16 hours, and they are most useful in patient with chronic heart failure and the patient who also has CKD, because torsemide is mostly metabolized by the liver. So bumex and torsemide, they are very useful in diuretic resistance. But if you have to choose between torsemide and bumex, bumex is better because it has high, it's more potent than torsemide. All loop diuretic are ototoxic, so if you are using them in IV form, you have to give it slowly to reduce the risk of ototoxicity. Loop diuretic, they are useful to decrease calcium. So if someone has hypercalcemia, you can use loop diuretic to lower the calcium level. So this effect is opposite to thiazide diuretic, which can cause hypercalcemia. So if someone has sulfa allergy, if any of your patient has sulfa allergy and they have to use the diuretic, loop diuretic, then you can use ethacranic acid, which is a non-sulfa loop diuretic. If you are giving diuretic to your patient, loop diuretic to your patient, and the response is poor, they are not making a lot of urine, you should always check if these patients are taking NSAID or not, because NSAID will blunt the response of loop diuretic. So these are the important clinical pearls and important information about loop diuretic. If you like this video, please share with your friends, and have a nice day.